From United Nations Television, this is UN in Action.
For poor women in Bangladesh, having a baby is dangerous. 18-year-old Taslima is pregnant and in labor. Her life is in danger. Kanchan Roy, a Bangladeshi health worker trained to conduct safe deliveries, is very concerned.
The patient was suffering from labor pains for many hours, and there was no progress. I told her relatives that this could seriously harm mother and baby. She has to deliver in the hospital, not at home or in the clinic.
But Taslima's father-in-law, the family decision-maker, brought her back home rather than pay for a longer taxi ride to the district hospital in Molbi Bazar. Beauty, 4 months pregnant at 16, is not well. Her mother brings her to the village clinic. She has anemia, jaundice, and an infection. Roshana, the community skilled birth attendant, tells her that she needs to go right away to the health center in town. 2 days later, Beauty is still at home. Her family is giving her ineffective herbal remedies. Every year, thousands of women here die from avoidable causes during pregnancy and childbirth. 3 out of 4 women still give birth at home with no one who can assist if things go wrong. But the situation is changing. Hundreds of nurses are now being trained. The government, with support from the UN Population Fund, UNFPA, has pledged to deploy 3,000 midwives by 2015, upgrading their skills to international standards. Dr. Babatunde Osutimehin, the executive director of UNFPA, the UN Population Fund.
We know that the best intervention and the most important intervention in reducing maternal mortality is having a skilled birth attendant during the process of labor and childbearing.
Rekha Rani Mistry, a newly trained midwife.
When someone comes for a prenatal exam, I give her advice about pregnancy and childbirth and counsel her to give birth in the hospital. When the time comes, I will conduct the delivery myself.
With better trained staff and improved facilities, more women can now get prenatal care and skilled delivery assistance right in their own communities. 24-hour emergency care is also available now at the Molbi Bazar District Hospital since the UN project provided new equipment and helped train additional personnel. But too often the services remain unused. Community health educators are now taking on the urgent task of informing women of the importance of staying healthy during pregnancy and persuading families to use the services available. Fortunately for Taslima, she got there just in time. And after emergency surgery, mother and baby were safe. Beauty had to wait briefly for a bed, but soon started treatment and went home 6 days later in much better shape. With increased trained staff and facilities that can safeguard the lives of mothers and newborns, Bangladesh is striving to take the danger out of childbirth. This report was produced by William A. Ryan and Mark Westhoff for the United Nations.